Welcome to Dentca, the world's first CAD-CAM denture. This introductory video will acquaint you with the Dentca system and allow you to incorporate it into your practice today so that you can start providing better and more predictable prosthetics for your patients. What is Dentca? Dentca is a company based out of California that fabricates digital dentures. Impressions are made by the dentist, then digitally scanned in Dentca's facility, and CAD-CAM dentures are subsequently fabricated. The Dentca CAD-CAM process is based on sound, literature-supported techniques, which are then combined with cutting-edge technology to provide clinicians and patients with a better, more predictable product. Finally, Dentca simplifies the denture process. Not only does it shorten the treatment time and number of visits for patients, but it simplifies the denture protocol for clinicians and makes it more predictable. Dentca allows clinicians to provide quality CAD-CAM dentures for their patients in just 2 visits. At the first visit, the Dentca protocol is followed to capture accurate impressions and interocclusal records. That information is sent through the mail to Dentca in California, and the final denture can be seated on the second patient visit. The clinician may also elect to have an optional try-in visit between visits 1 and 2. This try-in visit is recommended for those just starting with Dentca or if a patient's case is more complex, functionally or aesthetically. Once Dentca receives the impressions, they are scanned into Dentca's software. The software identifies more than 26 anatomic landmarks on the scanned impression and utilizes this information to determine the ideal functional and aesthetic situation for each patient. This includes tooth selection for both posterior function and anterior aesthetics, the correct midline, the ideal occlusal plane, including the curves of Spee and Wilson, the correct articulation, as well as the post-palatal seal so that the denture will have ideal retention. Once the impressions are scanned and digitized and a setup is determined, Dentca uses 3D printing technology to print an optional try-in denture. This replaces the wax try-in step for conventional dentures. Once this try-in denture is modified or approved, it can then be converted to the final denture through a proprietary conversion process. So why choose CAD-CAM dentures when clinicians have been using conventional denture methods for so many years? The first reason is fewer visits for the patient. The conventional denture protocol includes a first appointment for initial alginates, a separate visit for final impressions with custom trays, a third visit for interocclusal records, including face bow, vertical dimension with a wax rim, and centric relation records, and then a fourth visit for wax tooth try-in, and finally denture delivery. As such, conventional denture protocols typically take a minimum of 5 visits, with additional visits if anything needs to be repeated due to distortion, miscommunication between the clinician and the laboratory, or for any other reason. With Dentca, most of those visits are eliminated. As previously described, this technique requires just 1 visit for impression and records, and 1 more visit for delivery. Secondly, utilizing the Dentca CAD-CAM system minimizes chair time, which is a benefit for both the clinician and the patient. The conventional procedure, as described, can take 5 or more hours of chair time with those 5 or more visits. There are several laboratory steps involved, which can end up taking a month or more to have the final denture fabricated. The Dentca protocol takes only about 60 minutes total of chair time, and most of that in the first visit. Additionally, since there's only 1 laboratory step, or 2 if the optional try-in is desired, it significantly shortens the treatment time from start to finish, which patients truly appreciate. Another great benefit of the Dentca system and CAD-CAM dentures is the ability to duplicate the denture without any additional chair time. In practice, clinicians often see patients with conditions such as Parkinson's or Alzheimer's disease who frequently drop or lose and break their dentures. Also, patients in nursing homes or those who frequently travel often have dentures that are lost or stolen. Lost lower dentures are particularly common, as many people will take out their lower dentures for comfort while they're traveling. Dentca provides the opportunity to duplicate the original set of dentures precisely, with no additional patient visits, no additional impressions or records. This is incredibly convenient for both the clinician and the patient, as it eliminates stress on everyone's behalf. CADCAM technology also provides increased precision versus conventional dentures. With every step of conventional denture fabrication, there is significant room for error. There's expansion of stone, distortion of wax, and of course, human error. When sending wax setups back and forth to laboratories, there's significant risk for melting and fracture. With Dentca, wax is eliminated, which eliminates the risk of distortion throughout the process. And digitizing the process minimizes human error in setup and processing. Once again, welcome to Dentca, and congratulations on choosing to revolutionize your practice while providing an excellent product for your patient.